Hello, everyone. Thank you so much for joining us today. My name is Dawn Bornheimer. I'm the Director of Regional Partnerships for Cognito. We're going to speak today about supporting military children in an online program that we have made available to all of the schools and school districts to help them build better capacity for the adults that support this vulnerable population. Before we get started, I certainly want to make sure that we do disclosures. So again, I'm an employee of Cognito Solutions, LLC. There are no other disclosures to be made. So a little bit about myself. I was a Baltimore City public school teacher for 5 years. I taught 1 year of special ed, K to 4, 2 years of 3rd grade, and 2 years of 5th grade. As you may be aware, Baltimore City has several children that often have experienced one or more adverse childhood experiences, which makes them a vulnerable population as well. Not many military children in Baltimore City, but certainly children that have experienced some other adversities with the crime in the community, some of them growing up in poverty, many of them on free and reduced lunch, so on and so forth. And so as we proceed today, we will see oftentimes there are some synergies between these two different groups of vulnerable children. I'm also a daughter of a retired Marine. My father is a very, very proud Marine, served in Vietnam, and it certainly has impacted the way in which my home was run and the way in which I grew up. I am the significant other to a United States Coast Guard commander. He's currently in command of the ship that you can see here in the image. And we are a proud military couple relocating about every 2 years. So often interacting with different families throughout his command. And in this case, he is in command of an entire group on the ship full of officers and enlisted members. And so balancing those priorities and the family responsibilities is also a function of his leadership. And I'm passionate about mental health. Working with Cognito and a strong social impact mission after having been a classroom teacher definitely ties some of my passions together. And I look forward to sharing with you a little bit more about the work that we do. So a little bit about Cognito. Cognito is a health simulation company. We focus on the power of conversation. And in this case, we're an evidence-based program. So our simulations are built on communication skills. And we use role play with virtual humans to help provide a safe learning environment to build confidence around those difficult conversations. In this case, we're going to be talking about the conversations with military children, but there are several conversations within our K-12 platform, and so we're going to talk a little bit about that today as well. Just so that you are aware, we have served over 1 million educators, students, parents, clinicians, and patients with the Cognito simulations, and we have observed and driven sustainable behavior change as a result of our services. So here's a little example about the portfolio that we have available at Cognito. So as you can see, we do at-risk work for elementary, middle, and high school. We have a student-facing product that is focused on conversations between high school peers called Friend to Friend. We've done work in trauma, bullying, suicide postvention. That program is called Resilient Together. And then we've also taken a look at unique populations such as military children, tribal youth, LGBTQ, and others that have experienced trauma such as the victims of Harvey in the Houston area. So in terms of learning objectives for today, by the end of the session, we will hope that each and one of you understands more about the unique situations military youth and families face. Describe 3 advantages of the use of virtual role play to build skills and self-confidence, and explain why schools and school districts and outside of school programs might consider this online method instead of face-to-face training. So here you'll see some active duty, reserve, and guard statistics. And so essentially what I want to draw your attention to is just the robust number of military families that exist throughout the country. And our active duty military may or may not live near military installations, but more frequently do, whereas our reserve and guard members can live anywhere around the country and perhaps serve 1 weekend a month. That is until they're activated. My brother-in-law of 27 years, Command Sergeant Major in the Army, was activated several times. And so when he was otherwise just serving in the National Guard, he would leave his family for 1 weekend a month. When he was activated, he was deployed overseas for upwards of a year. And so those family circumstances can change quite quickly. So some facts that you may or may not be aware of, I would expect most of us that are attending these sessions have a military connection. I know the theme of this conference is focused on military families at times, and so one of the things that's most important for us to note is just how prevalent these children and who they are to us. And so 2 million military children have experienced a parental deployment since 2002, and as many of you know, the events of September 11th were in 2001. And so since then, we've seen a skyrocket of these numbers, and more children are, as a result of that, seeing parents being deployed. School-age military children have added stressors associated with school transitions. And so thinking about the average child, maybe perhaps, your own upbringing, you may have changed schools when you went from elementary school to middle school. You may have changed schools from middle school to high school. These children change schools far more frequently. And in fact, they may change schools at an average of 9 times during their K-12 schooling. And so if you think about being the new kid or the first day of school, that happens to these kids far more frequently. They're moving across the country at times. They are changing countries at times. They are moving different school systems. They're leaving their friends behind, and they're asked to acclimate to a new school environment. And at various ages, developmentally, this can be far more challenging than we may be aware of. So unique stressors, although many of these families exhibit high resilience, so a military family may teach their children through their example about resilience and being adaptive. But these military children are at an increased risk of emotional and behavioral difficulties, exposed to intimate partner violence at times, and child maltreatment. So when we talk about those situations, we're talking about families perhaps after the military member comes home from deployment. They are not the same person they were when they left. And with the best of their ability, they're stepping back into their daily responsibilities. But as you can imagine, driving a tank in Afghanistan and coming home to drive in traffic on 95 is a different experience. Dealing with the day-to-day nuances that may present through everyday life, somebody cutting your lawn and a rock flicking up and breaking a window is very different than what they engaged with in combat. And so those are some extreme examples, but we just need to acknowledge that these children are then going to grow up in a home, perhaps where people are learning to navigate anger management. They're learning to navigate a new normal. And so as a result of that, the adults that are mirroring these behaviors are teaching children directly and indirectly some things about their own coping skills. And so this at times can negatively impact the children. So we're going to go over a little bit about deployment cycles, and most of these may be familiar for you, but if not, hopefully we'll learn a little bit together. So pre-deployment is focused on the time where the parent may be in training, and they could be coming home every day, but they're going to prepare for what they are going to do when they are deployed. Deployment will take the parent out of the home. This can leave children a little anxious about their parent's safety and or just having to navigate a different set of household rules while this parent is away. And then perhaps the parent that is at home taking care of them is now at a higher level of stress, perhaps a little more fatigued, perhaps a little anxious themselves. And so the children are watching and seeing all of these things in action. R&R is sometimes when a parent can come home for upwards of a 14-day leave, for example, and the children are super excited that they came back, and they can't wait for them to come to their school play or to come to their practice or come to their games. And, you know, that parent is coming home as a military member and needs to decompress and oftentimes has to return. And so just having a conversation with a child about the fact that their mom or dad is home, but only for a short period of time, and then they have to go back, often can be more disruptive than them continuing to stay away until their deployment is over. Post-deployment, that's when the parent returns home from deployment. The family needs may have adjusted while they were gone. Daily life may have shifted and changed, and now that individual wants to jump back in and or needs to transition a little bit slower. But there's some noticeable behavior changes around the family dynamic and just navigating communication and the new normal for the family as a whole. And then there's a note here at the bottom around members of the National Guard. They might serve part-time, and live as civilians otherwise. So until they're activated, that perhaps is their normal for their family structure. So what role do the teachers and staff play in school mental health? As many of you know, there are, classroom management responsibilities, building personal relationships, taking a look at creating such a learning environment for these children, school environment that feels safe, where they can express themselves, where they can interact socially and feel emotionally supported. We also want to take a look at becoming the eyes and ears for mental health services. So when we notice a child in crisis, when we notice something a little bit different than their normal, perhaps they're withdrawing, they're not completing their homework, they're not completing things on time, they're coming to school with their clothes dirty. Those are some extreme examples, but often things that we'll encounter, and there's often a reason behind that. And so we want to be able to make the referrals as necessary to those individuals that can support those children, perhaps inside your school. That would be a counselor or a social worker. So referrals in that case, right, creating the conditions for the warm handoff to the mental health professional. We don't ask the teachers to become the counselors, but what we do want you to be mindful of is that it isn't possible for one school counselor to see everything they need to see and to know about every child in the building. And since you guys are with them every day, right, our educators are going to be the eyes and the ears, and they're going to be able to make those referrals. And so the ongoing support and accommodating the return to learn, those light touches of observation, those check-ins. Hey, Susie, I realized that you were at a school last week. I heard from your mom that your dad had come home, from his deployment. Did you guys get to do anything fun this weekend? Kind of recognizing, acknowledging, and then also just transitioning her back to school and saying, okay, well, I know you probably didn't get all your homework done this weekend, but we got to keep going, and we're going to work on some new things this week, and I'm sure you'll be excited to bring that work home and to get a little bit of extra help with your homework. Something to that effect, just those light touches and just the opportunity to continue. And then continuous promotion of positive learning environment, just continuing to reinforce all of the expectations of the class and providing that structure that these children need. So we all need the school gatekeepers, classroom teachers and school staff. They can serve as gatekeepers for the function of these early identifications and referrals. And so there's just an acknowledgement that teachers are not often taught these skills during their preparation. I did my master's at Johns Hopkins, and in the time I took classes there, I was taught a little bit about psychological distress. I had some coursework on psychology, very general coursework, and at a very predominant, educational university program, I can speak very confidently in my own limited education around these adverse stressors for children. I happen to have an undergrad in clinical psychology, which allows me to have some of that experience and some of that intuition, if you will, to know that something was not quite right with one of my students and the ability to dig in a little bit. But we do acknowledge that not all education programs are teaching these skills at the level that educators need to be prepared for this time in the state of the world, right? The way in which social media is feeding into the everyday, and the kids having more access to these other resources and the video games that they're playing. So approaches to talk with these students and learning some of the mental health support services that are available, and then simply the ability to make that crosswalk for them. So we do acknowledge that there is work to be done, and perhaps professional development will be the right way to provide that additional support. So here's a screenshot of the simulation that we have for supporting military children. I'm going to go over some of the features with you, and after this webinar, you're going to be given a link to a demo that you'll be able to access and take part as a user. As you move through the simulation, I'll encourage you to take a look at some of these features. So you're going to assume the role of an after-school program director. The student that is sitting there with you, his name is Sam. Sam is a virtual military child. His dad is in the Army, and he is having trouble adjusting socially and is misbehaving as a result of it. He seems to be having a short temper. He seems to be getting frustrated with a couple of their children, and you have observed these things happening. There's a virtual coach. Her name is Jackie. If you look to the bottom of the screen, you'll see Jackie's image there. Jackie's going to engage you in a few ways. First and foremost, she's going to do a didactic component in the opening. It's about 5 minutes. She's going to then introduce you to Sam, and the conversations will begin. While you're in the conversation menu, you're going to always have a few options. You're going to have a couple of different options in terms of what you want to say to Sam. That will be under the talk selections. And you'll always have the option of undoing. So if you observe that what you selected is not getting Sam to open up and engage with you, perhaps you need to spend a little bit more time building rapport and earning the right to ask Sam some of the more difficult questions. Coach Jackie may give you some feedback that may make you want to undo your choice and then re-enter the conversation in a different way. As you learn, you'll be able to do this. You'll be able to navigate your way through several correct decisions, which ultimately will have you and Sam come up with a plan for next steps and how to move forward. So while you're using the conversations as an opportunity to build your confidence in speaking with Sam, you're also going to learn how to reserve judgment, how to leverage skills such as motivational interviewing, and how to maintain empathic accuracy throughout those conversations. So there's underlying learning and methodology that goes into the work that we do. So taking a look at the learning model, evidence-based communication tactics are drawn from components of neuroscience, social cognition, adult learning theory, and applied gaming mechanics. And so motivational interviewing might be a term that you guys are familiar with, providing affirmations, asking open-ended questions, reflective listening, and summarizing client statements. So in this case, the after-school worker was trying to connect with Sam and learn a little bit more about him. As you navigate through the conversation, Sam would have shared that his dad is in the Army, and they actually found out that they were moving early. So Sam's expectation was that he was going to be living at in his last house at his school for upwards of 3 years. He was going to be there just a little bit longer, and that changed. His dad's orders changed, which brought them to this new school earlier than expected. And so using reflective listening, the after-school worker would have learned more about Sam. And emotional regulation is basically what when we're talking about emotional regulation, we're focused on the ability to have empathy without actually taking on the emotions of the person in which you're engaging. And so in this case, if Sam gets angry, we're going to keep our tone and our voice at an even level. So we're not going to raise our voice because Sam is raising his voice. When he gets angry, we're going to remain calm. By mirroring that behavior, we're going to encourage Sam to relax and calm down a little bit and show that we're engaged in listening to him and speaking with him a little bit further. So some people question the reasons why we use virtual humans. It's something that not everyone is familiar with, but it's actually quite effective. So the benefits of using virtual humans to engage in conversation is that it provides a safe environment. It actually increases the likelihood of engagement and openness for the user, and it decreases the transference of any type of interaction you might have with a peer. So if you were to sit across from someone, another educator, for example, and be role-playing, oftentimes the expectation that you may have, or of someone judging you perhaps, or the experience of thinking to yourself, this person knows what I'm supposed to say. If I make a mistake, they're going to be judging that. So just that ability to navigate in a safe learning environment, make mistakes, and learn from those mistakes, continuing to navigate in and out of the conversation, using the undo button, using the coaching from Jackie, and really just having the opportunity to navigate that, build your confidence around conversations with Sam. Other benefits include, personalization of the experience, and it's easy for us to, disperse it, support different languages, and it can be a just-in-time learning, so people can access it as needed instead of saying, okay, we're going to do a training at the end of August and everyone is going to have this defined amount of time. If there is an interaction that you want to prepare for, you would be able to access the platform regularly. And of course, just the virtual human environment makes the ease of that interaction in a gaming format. So we do have some results regarding some of the implementation that we've done thus far. So we use experimental procedures. So for everyone that has used supporting military children thus far has engaged in a pre-survey, they've completed the simulation, and they've engaged in a post-survey. 3 months after that, we asked them to take a follow-up survey. This is the demographic of those that participated. As you can see, it was a small group. We did have only 32 people participate, and 45% of the participants indicated that they have a military child in their class. So satisfaction measures, 91% rated the simulation good to excellent, 91% would recommend the simulation to their colleagues, and 88% agreed or strongly agreed that all educators in their school should take the simulation. We took a look at role identification. There's a significant increase in the participants assuming the role to help a military child to adjust. So perhaps where they would have referred the child, now they feel more confident that they can actually be the person to build that connection. Preparedness, so pre-training versus post-training, so taking a look at feeling more prepared. Attitudes of their likelihood to engage. Self-efficacy is also increasing. And then overall behavior measures. So this is from the pre to the 2-month follow-up. Again, the 42% increased the number of conversations with military children. So they were more likely to engage, and they actually did. So this increased the number of conversations that they had. And then the conversation topics that they spoke of. You know, challenges around adjusting to school, helping them make friends, the struggle they might be experiencing at school, or what it's like to have a family member in the military. Some people can connect better than others if they have a shared experience, but the simulation allowed the educators to feel that even if they didn't have a shared experience, they now had a better understanding of what Sam may be experiencing, and then in turn, their own student. And here's a summary of some of the open-ended responses we received. So some of these are very impactful, but take a look and see if any of them jump out to you. In this case, although these are geared towards military children, they can be adaptive. So when I taught in Baltimore City Public Schools, for example, there was a 45% transfer rate. That means kids were changing schools at a rate of 45%. The likelihood of them changing schools multiple times during elementary school was pretty high. And that had a lot to do with the economy. That had a lot to do with them renting. So if the rent was getting increased every year and there was a certain budget for the family, they often had to find a new place to live when the rent was exceeding their budget. Section 8 housing, for example, or Sally Mae, or any of the other things that they were government funded, some of those changed. And when those things changed, it caused the family situation to change. They may go and live with a relative. So those transient kids have some of the same challenges. The schools being willing or able to identify these kids. So Sam showed up for school on day one, just like all the other kids. This after-school program started and Sam was there the first day. So that after-school worker was not clear that Sam was a military child until he sat him down and engaged with him. And so having designated staff that can work to speak with these children is important. And then often supporting these children and their parents in dealing with the challenges of that parent's deployment. So making it okay for the parent that is going to be home to come to the school, be welcome to share that with the educator, building that relationship so that they know they have the extra support and they can speak with the children. So we encourage the parents as well to engage with the educators as much as the educators to engage the parents. We do have some limitations to the study. So as you saw, that 32 participants is a small number. So insufficient sample size to conduct a full analysis. Self-reported data on behavior outcomes. So everyone is telling us what they see, the change in themselves. So that's just also creates somewhat of a limitation. Overall sample size was low, and it is not a randomized control trial. So the last thing I want to share with you are some free resources that Cognito has created in conjunction with the funds provided by the Robert Wood Johnson Foundation. The one that is most applicable to you as an audience is in the bottom right-hand corner, Calm Parents, Healthy Kids. This focuses on early childhood. So this is a role play with a parent and otherwise a pre-K or small child ages 2 to 5, where the child is being disruptive and having some behavior issues. And so just learning to speak to your children in a safe way and building some of those conversation communication skills at an early age is so important. And the Robert Wood Johnson Foundation partnered with Cognito to bring those simulations to you, and they can be accessed at conversationsforhealth.com. So we encourage everyone to check those out. The other resources will be available on that page as well, so you can certainly take a look at those. But in this case, that bottom right-hand corner, Calm Parents, Healthy Kids, is the most applicable. So Conversations for Health, the simulations were developed by Cognito with the support of Robert Wood Johnson Foundation and are available at no cost. Here's a brief overview of what those programs are designed to do. So engaging in practice conversations with virtual humans, build your skills to lead real-life conversations. In this case, we're talking about parents developing the skills and the self-regulation to manage challenging behavior of a child ages 2 to 5. We want to mitigate the effects of trauma and adverse childhood experiences, and what better time to start than when they are very small, before they are school-aged. So that's all we have for today. We do want to invite everyone to check out our Supporting Military Children work on the cognito.com site. If you are interested in using Supporting Military Children with your district, you can feel free to email me, and we can send you a demo and talk a little bit about how that would look in your district. We would love to see the sample size grow for the programs that are implementing Supporting Military Children, and talk a little bit about the customization that would be needed to support you and your schools. So please let us know if there's anything that you need. And again, my email address is on the screen should you want to reach out and chat a little bit about the uniqueness of your district and how we can help. Thank you so much and have a great day.